Hi everyone, this is Kathy Langell, and we're going to be talking at the start of week 2 on community assessment. And I want to get you started in the right direction so you can complete this very important assignment. The nice thing about this week for our course is that there are no submissions due. Um, there are no discussion questions and no other assignments except to get out there and start working on your community assessment, the windshield survey. Let's start out talking about where the directions are to complete this assignment and how important it is too. Um, if you look in the assignment instructions and rubrics folder, that in the same listing where all the lesson plans are, and go into the windshield survey community assessment, it gives you just excellent details about what needs to be completed and how to put this project together. As I said when we were talking about the assignments in the introduction to this course, this isn't a difficult assignment, it's just time consuming and you have to put a little bit of thought into it. So don't get put off by the detail. It really is going to help you really assemble this, and they're wonderful to look at. I just enjoy them so much. I'm anticipating seeing some really interesting assessments, community assessments, when you get them put together. So they follow a sequence. The first slide, um, and there are numerous ones that again are giving you directions in the instructions for this assignment, but the first slide in each of the content areas will have photos that you've taken. And please, if you look at the directions, don't try to take photos while you're driving, and really don't get out of the car, because what we want this to be is, that's why it's called a windshield survey. You don't have to feel like you have to get out and walk around the neighborhood and take photos. In fact, I had a class in the spring where the students said that some of the residents in the area, because they did try to do this, were getting a little bit cautious because they were wondering why people were taking photos of their neighborhood. So do it from inside your car, and don't do it while you're driving. Please be safe. Um, so again, the first slide will be the photos. The second will be your objective information that you've discovered about this particular piece of the community. And then the third is your evidence. So you're, again, using a variety of databases to document the kind of statistics or the information that you're presenting about the citizens, the community that you're looking at. Again, take a look at that. If you have questions, please email me or call me and I can help or assist you with that. As far as gathering the statistics, if you continue looking at the instructions, they give you a number of different sites that you can use to gather information about different aspects of any community. One of them is called American Fact Finder. You can also go into the census data. Vital Statistics is another important database that you can access. And I really recommend, too, that you go to your county or city public health department website, and they will have numerous community assessments available to view. And again, this is such good data, and this is exactly what these community agencies, public health departments need to do when they are program planning, which is what we're going to talk about next week. Um, this is the foundation. They're going to go out and collect data. They're going to analyze it and then decide where the deficit areas are, or areas of health that they need to focus on so that they can make people in the community healthier. It's that health promotion aspect that we're just really is the basis of what we're doing. Illness prevention and really trying to keep the population as healthy as we can. Even if you're not looking or not placed at a public health department, ask your practicum site what kind of assessment data they have, and they'll have it. So please make use of those resources. There's just a lot of information out there. And again, it can be a real interesting process. You're going to learn a lot about the area that you're surveying. Um, And it really comes down, when you look at the PowerPoints for this week, we're really focusing again with this community assessment on three aspects, and I just want to point you to the important ones. We're looking at the people, at the residents, and we're again gathering statistics. We want to look at their morbidity and mortality rates. We want to look at the neighborhoods that they're living in and what the crime rate is. We want to find out if there's any kind of satisfaction surveys done for these people, maybe via the healthcare systems or the hospitals that are in their area. You also, again, want to get a sense of the geography and of the place that you're surveying. And again, with having a zip code, you're going to be able to have a very concrete idea, um, using streets actually as boundaries as to what makes up the community that you're looking at. And then the final one is the function. And these are all the activities that take place in the community, the kinds of businesses that are present, the schools, the healthcare facilities, the agencies, the hospitals, whatever is there, police station, fire station. Again, look at that listing of the kind of, or the content that you'll be taking photos of, and you'll get a real sense of the kind of information that you're going to be gathering. And just to re-emphasize, again, this is the basis for planning healthcare in the community. Doing a sound assessment, having somebody then analyze the data and pick out the important priority health concerns, and then putting that programming into place. And that's what we're going to talk about next week. We're going to look at program planning. And that will lead nicely into your next assignment after the windshield survey, and that is, again, and this is actually to be posted on the discussion board, it's looking at or planning a nursing care plan, a community nursing care plan. And again, we'll talk about a lot of those pieces next week. The other areas that I want to point you to, there is a section in the PowerPoints this week on evidence-based practice. And again, I think it really is a nice addition. It just kind of reminds you, again, I know you've all heard this in your workplace, evidence-based practice, but it really is important, especially in any area of healthcare, but we're going to use it as well as we plan care for the community. And also, when you're selecting articles to back up your main environmental issue, you should be thinking about the validity and reliability of those articles, and making sure that they're sound. Remember, evidence-based practice, it closes the gap between research and what we do on an everyday basis. And it really, again, is helping us plan care using scientific knowledge and research. And again, success that we've seen documented because of research studies versus intuition or what our past experience has told us. So not that past experience isn't useful. It is. And again, that is one of the valid pieces of evidence-based practice if we don't have a lot of research, actual research out there. But really critically look at the kinds of articles that you're choosing, and then the interventions as we start doing some community healthcare planning. Next week, I will also, I'm going to upload it into Lesson 3, point you to a huge document. I hate to say it like that because it sounds like it's so overwhelming, but it's something called the Minnesota Intervention Wheel. And it is strictly based on research, and it looks at a variety of interventions at different levels of patient interaction in the community. And it was put together by a number of public health nurses that really sat down and looked at what nursing involves in the community, what kind of interventions are they utilizing to improve the health and well-being of the patients that they work with. And again, keep in mind that most public health nurses, and certainly some community health nurses, are not going to be doing actually hands-on nursing. Their role in many cases is teaching, referral, collaboration, and again, we'll look at all of these specific interventions because that will certainly, again, assist you when you're thinking about putting this community nursing care plan in place. So hopefully we'll make this an easy process, and I'll give you some hands-on examples too. So I hope this puts or places you in the right spot for week 2. I am currently looking at your posts, and I will give you some feedback on that. And then the next assignment that I'll actually be seeing from you is your review of the environmental health issue. So you're taking that article and again reviewing it and substantiating it with 2 other articles that support your viewpoint. So again, if you have questions, please email me. If you need to call, please do so. And please enjoy this assignment this week. It is really very interesting, and it really gets you out into the community so that you can get a feel for what's out there. And it really is, this is just one of the most important pieces or tasks that community health, public health nurses have to accomplish. So I'll see you again next week. Bye.